Purpose is not just to see how a hospital works, but what the community is like in which you find the hospital. We give them an opportunity to go into people's homes and do these home visits. It's easy to look at a shack through Newsweek or Time or on Fox News or CNN, but to actually go into a person's home and walk up those precarious wooden steps on a stilted house and walk into a one-room place where people sleep, eat, and cook in one room and wonder how someone can live like that is a very, very impactful experience for them.
We went out, it felt like it was in the middle of nowhere, and visited this widowed woman who lived with their 10 children, and the amount of money that was her monthly income was just shocking when you consider how much money we spend every day on coffee. And we just talked with her, and that was probably the most powerful experience of the whole trip.
This year we have a lot more of the hands-on practicum type of approach where students do go out and they get that, maybe for some of them, the first chance to start interacting with patients. There's a clear need in a lot of these communities where people don't have access to good health care. And there's an opportunity for us to go out and provide that, and also provide the students with their first encounter. And we do that always with the doctor there. So there is someone who has the adequate training to guide the students through that process. As far as animal health, Dr. Chris Olson is with us when we go out and treat the animals.
There is a very close connection between the Ecuadorian people, in particular the indigenous Andean people that we work most closely with, and their animals. And that runs the gamut from simply the recognition by the people that their animals are very important to providing nutrition for their family, all the way to, really very sort of spiritual level relationships. The cattle and the pigs and the sheep and goats we were injecting with an anti-parasitic medication. So in addition to doing some hands-on veterinary medical care, we also tried to do some education in the villages. I think we can have a much bigger impact through education than we can by primary care. So certainly they get a little bit of hands-on skill in terms of handling animals, restraining animals, injection techniques and things from our village health campaign days. But that's clearly not the overall goal.
The purpose is to deepen students' awareness through community engagement. And in the summer of '05, we worked in two indigenous communities, collaborating with NGOs that had been working long-term in those communities.
We brought with us from the United States a limited number of over-the-counter medications, primarily analgesics and prenatal vitamins. But we also partnered with a local clinic in Otavalo, through which we were able to obtain some additional medications that we distributed in the two villages that we visited during the field school. These medications were primarily for some primary care problems that we knew that we would encounter, namely for the treatment of parasitic diseases, scabies, head lice. We also had some antibiotics that we could offer for the treatment of acute infections.
A number of the students are in very early stages of their professional education, so they don't have a lot of skills to deliver care, and I'm not sure that that's even a model that we want to be involved in, is delivering health care, because it's not a sustainable effort. However, where all of the students can become involved is really looking at experiences that are very community-based, that involve community education, public health campaigns that are really coordinated by other agencies that are in Ecuador, know their people and their population, and we have the privilege of being invited to accompany them.
More formalized opportunities for teaching come when we go out to these field visits and we have demonstrations. For example, this past program we did a demonstration for dental health. Someone donated a lot of toothbrushes and dental floss, and So we'll go out and just talk about dental health, the importance, because dental health is associated with a lot of health problems in Ecuador. One example would be with pregnant or lactating women who have lost teeth and they can't eat a well-rounded diet. They can't chew vegetables and things that are a little bit harder to chew and digest. And as a result, it not only affects the health of the mother, but it affects the health of the child. So all these things, we see it more holistically as, you know, dental health as being part of this broader picture of health in general. So we go and we give this demonstration for dental or oral health, demonstration on treating water, because a lot of the illnesses, just the fundamental illnesses in Ecuador, come from drinking contaminated water or water that has some bacteria in it. Parasites a lot of times come from that. So we have a demonstration on how to treat water and the importance of drinking water that's been boiled or treated.
I think it's difficult to do an evaluation of an experience like this immediately after the experience is over, because oftentimes the impact doesn't hit until months, sometimes years later. And so we'd like to follow these students out over the years and see what they say about these experiences. But clearly it makes them better physicians, better nurses, better veterinarians, and better pharmacists. So that's one of the main objectives of this thing.
This trip, by placing you in a completely different environment and outside of your normal comfort zone, I think really forces you to open your eyes and pay attention to all of the complicated factors that influence healthcare. And I think this probably would not have been possible to do in the United States.
It will make me more conscious of the patients that I'm interacting with and how their backgrounds influence how they're perceiving their health and how they're perceiving their treatment. And then it will give me perspective so that I can be more effective in the healing process.
It's just such a well-rounded experience. I mean, between your professors that are with you teaching you things and your personal experiences with your families and all the people you get to meet, and you really get to, I think 2 months is long enough that you actually get to, be there and, soak up a little bit of the culture and really see what Ecuador is really about.
I believe that by going to Ecuador and experiencing living in a new environment, they have a much heightened awareness and sensitivity to the many adaptations that people from diverse cultures must adapt themselves to adjust to environments here in Wisconsin. So I believe that this type of an experience is good for our students, not only in expanding their worldview, but also in making them more capable as health professionals for the diverse populations that they will care for in the future.